It starts with a siren, a call for help. A stranger races to save a life. But in America, that familiar sound carries something else, a warning. Because behind the flashing lights, there's a cost. Not just emotional, not just physical, but financial. And for some, it's too much to bear. Let's go back to a Tuesday morning in Phoenix. A woman makes coffee like always. Her husband is reading the paper. He coughs just once, then clutches his chest and slumps forward. Panic. She rushes to his side. He's still breathing, but barely. Her phone is in her hand. 911 stares back from the keypad, but she doesn't press it. 2 years earlier, when their son broke his arm skateboarding, the ambulance ride cost them over $1,700. That bill lingered. She never tells the kids that she had 911 ready on her screen. But every day since, she's imagined pressing that button. This isn't an isolated tragedy. It's a symptom, a sign of something deeply broken. Most Americans don't realize this, but ambulances are not officially considered essential services in many parts of the country. Unlike police or fire departments, which are required by law to be funded by municipalities, emergency medical services, or EMS, are often left out. This bureaucratic detail has far-reaching consequences, many of which aren't obvious until you're making the call. Instead of guaranteed funding, private companies typically contract ambulance services. These companies bid for the lowest cost agreements, aiming to stay profitable while managing tight operating margins. It means fewer crews on shift, older vehicles, less redundancy when things go wrong. This means that patient care, at times, must answer to financial spreadsheets, not just medical urgency. This isn't a fringe phenomenon. For example, in Orange County, North Carolina, half the county's ambulance fleet has outlived its recommended service lifespan. Some vehicles have driven well over 150,000 miles. Across the U.S., cases of ambulances logging more than 400,000 or even 500,000 miles aren't unheard of. In 2022 alone, over 14,000 mechanical failures were reported in EMS vehicles, up from the previous year. Even when a department has the budget to buy new rigs, shortages in critical vehicle parts and manufacturing delays mean replacements can take years to arrive. What happens in the meantime? The rigs stay on the road, EMTs cross their fingers, maintenance becomes a weekly ritual, and breakdowns become part of the job. The people behind the wheel? They're some of the lowest paid frontline workers in the country. In many counties, paramedics make less than $20 an hour. For that wage, they work long shifts, often 24 hours, and respond to life or death situations multiple times a day. They might go from a fatal overdose to a car crash, and then straight to a patient having a stroke. Then they sleep in the cab, or not at all. They eat on the go. They do paperwork between sirens. Many burn out in under 2 years. Still, most EMTs will tell you they love the work. They just don't love how it's treated. Now let's talk about the cost to the people they serve. In the United States, a single ambulance ride can cost anywhere from $900 to $2,500 or more, without even considering the hospital treatment. The actual amount depends on the type of care provided, the distance traveled, and whether the ambulance company is in your insurance network. If it's not, you could be billed at full price. Procedures add up quickly. Oxygen, IVs, or even simply riding in a vehicle designated as advanced life support can add hundreds of dollars to your invoice. And here's the catch. You don't choose which ambulance picks you up. In an emergency, you don't check a provider list. You call 911 and whoever is available arrives. Later, you find out whether the ride was covered. For many people, the first time they learn their ambulance wasn't in-network is when they receive the bill, days or weeks after a medical emergency. This lack of coordination between insurers, providers, and hospitals turns a basic act of survival into a financial trap. And it's not just an inconvenience, it creates hesitation. Imagine you're experiencing chest pain. It's probably nothing, right? You hesitate, not because you're stubborn, but because you've read the headlines, because you remember that last bill, because your insurance deductible hasn't been met this year. And in that hesitation, something ruptures, a clot moves, a heart fails. Delays caused by financial worry are real, and they are deadly. Studies have shown that due to cost, Americans are more likely than Europeans to delay or avoid emergency care. The mere existence of price tags on 911 care adds a dangerous pause to situations where seconds matter. Now let's look overseas. In Denmark, when someone collapses on the street, help arrives quickly. National standards regulate response times, often targeting an arrival within 6 to 9 minutes. Ambulance crews are part of a national health system. The equipment is modern. The salaries are fair. The training is comprehensive. And the bill? There isn't one. Ambulance services are covered by taxes automatically. There's no need to ask about insurance. No one in the ER asks about co-pays or deductibles. The person in need is the priority, not the payment method. This isn't unique to Denmark. Across Europe, in Germany, France, Sweden, and the Netherlands, ambulance services are structured as an integral part of the healthcare system. They are not profit centers. They are infrastructure. These systems are not without flaws. Wait times for non-urgent care can stretch. Budgets tighten during recessions. But for emergency services, the moments when life hangs in the balance, the system doesn't ask if you can afford it. It responds every time. Back in the US, EMS exists in a fragmented landscape. Some services are fire-run, others are private. Some bills are paid directly, others go through insurers, and some, particularly in rural America, rely on donations, fundraisers, or grants to stay afloat. This lack of consistency creates confusion for patients and chaos for providers. And still, the US spends more on healthcare per person than any other country globally, over $11,000 per capita as of the latest OECD data. That's nearly double what countries spend on more stable, publicly funded emergency systems. Yet the US has worse outcomes across the board: lower life expectancy, higher infant mortality, and more deaths from preventable conditions. So where is all that money going? When emergency care is handled like a commodity, it becomes subject to all the inefficiencies of the market: middlemen, upcharges, opaque billing systems, and administrative bloat. It's a system optimized for billing codes, not outcomes, and the consequences are human. Parents drive their kids to the ER rather than call an ambulance. Elderly patients wait longer to seek help. Some simply don't get care at all. The crisis doesn't look like a broken ambulance on the side of the road. It looks like silence. It looks like a family hesitating at the worst possible moment. During the COVID-19 pandemic, this infrastructure strain became even more apparent. Ambulances lined up outside overflowing hospitals. EMTs worked back-to-back shifts. Rural areas, already under-resourced, were hit especially hard. In some cases, hospitals and states were forced to compete for essential equipment, including ventilators and ambulances. Meanwhile, the national government mobilized medical trains in France to move ICU patients from overburdened cities to less crowded regions. In Germany, regional disaster protocols were activated, deploying ambulances and staff across federal lines with ease because the systems were built to be interoperable, because they were funded to serve, not profit. It's not that Americans don't care. It's that the system doesn't care consistently. When a patient's survival depends on whether the nearest ambulance company is for-profit or public, or whether your zip code is in-network, something is wrong. And that something isn't new. The ambulance crisis in America isn't just about outdated rigs or overworked paramedics. It's about decades of policy choices that turned a public good into a private product. It's about choosing billing over access and contracts over coverage. But perhaps most importantly, it's about the consequences of hesitation and who pays the price for that pause. A siren should mean help is coming. Not that a bill is coming too. It should be a promise of care, of urgency, of humanity. In much of the world, that's exactly what it means. But here, it's a gamble, a question, a hesitation. The ambulance crisis in America is not about equipment. It's not about shortages. It's not about EMTs, who are heroes every single day. It's about philosophy. Do we value people more than profit? In Europe, the answer is yes. In America, the answer still costs too much. Have you or someone you know ever hesitated to call an ambulance because of the cost? Share your experience below. If you believe healthcare should never come second to billing, like this video, subscribe and share it with someone who still thinks the system is fine, because no one should die waiting for a ride they can't afford.